My name is Lyndy Beckley. I've been a registered nurse for 12 years. I spent the first 6 years of my career in a cardiac step-down unit. The last 6 years I've been in the intensive care unit. I also have a master's degree in nursing, and I serve as an adjunct faculty member at Kent State Stark. So that's just a little bit about me and what I do. Grab my clicker here. I'm here today to talk to you about cardiovascular disease, which is also known as heart disease. February is Heart Disease Awareness Month, so this is a good time to just discuss heart health and talk about risk factors and prevention, as well as warning signs and treatment. So why should you know about heart disease? Heart disease is the #1 cause of death for both men and women in the United States and worldwide. Approximately 370,000 Americans die from heart disease every year. In addition, 750,000 Americans suffer from a heart attack, and about 116,000 of those people die each year. So what is heart disease? There are different factors that lead to heart disease. One is hardening of the blood vessels, and the other is a buildup of plaque. So as the vessels that feed the body become hard, they're less stretchy and less elastic. In addition, those vessels also have a buildup of plaque. Plaque is a buildup of fat and blood components, and as these components build up, they get stuck inside the vessel walls. So think about the plumbing in your home. As your pipes get clogged, debris builds up and the flow of water slows. It's the same with the vessels in your body. This buildup of plaque begins in childhood. And it continues throughout life, but it only becomes problematic when it gets so severe that blood flow is obstructed and causes symptoms. So both with the hardening of the arteries and the accumulation of plaque, the heart has to work harder to pump blood through these vessels and overcome these factors. So one type of heart disease is coronary artery disease, and this is the accumulation of plaque and the hardening of the vessels that specifically feed the heart. Peripheral vascular disease, or PVD, is a hardening of the vessels and accumulation of the plaque in the vessels that feed the rest of the body. So as the heart works harder to pump blood through these vessels that are harder and more constricted, it becomes weak, and eventually it doesn't pump efficiently. This is heart failure, and that's another type of heart disease. This can lead to activity intolerance, high blood pressure, irregular heartbeat or arrhythmia, as well as heart attack, stroke, heart failure, and even death. That one every 84 seconds, I believe, is what it ends up being. So as I stated before, the plaque formation starts in childhood and builds up over a lifetime. So on the left, you can see an artery with plenty of room for blood to flow. In the middle, you see plaque has begun to form on the walls of the artery, but it hasn't obstructed blood flow yet. And on the right, you can see substantial narrowing due to the plaque, which has significantly obstructed blood flow. This is a side view of the same types of blockages, but this is the arteries that specifically feed the heart. So as these blockages become severe, over here you can see the 90 to the 99% blockage. Blood flow to the heart is almost completely occluded, and then that tissue actually becomes damaged or dies. So this would be an example of coronary artery disease. So as the heart muscle becomes irreparably damaged or dies, this is considered a heart attack. So basically what happens is those arteries that specifically feed the heart are occluded. So the plaque builds up and those vessels harden, and blood isn't able to make it to the heart tissue. And it's not receiving oxygen. And as it stops receiving oxygen, that tissue actually ends up dying. So the severity of a heart attack actually depends on the amount of heart tissue that is damaged or dies. By being aware of the symptoms, some of the damage can actually be reversed if it's caught in time. Early detection and rapid treatment are the keys to restoring blood flow and heart function. The longer a person waits to seek treatment, the more the heart muscle is damaged or dies. That's why we say time is muscle. So early detection and rapid treatment are key, but they're dependent on recognizing the warning signs of heart disease and heart attack. Chest pain is the classic symptom of a heart attack, but not all chest pain is actually in the chest. It doesn't all occur in the chest. Chest pain can actually also be felt in the jaw, the neck, the shoulders, the abdomen, and the back. So not all chest pain is actually in the chest. Shortness of breath at rest, while lying flat, or while sleeping, and it can actually even wake you up, as well as fatigue or activity intolerance, which is not being able to do the activities that you could normally do. These are indicative of a problem. Palpitations or fluttering in the chest, or the feeling of your heart racing, is indicative of a potential irregular heartbeat. Fainting, nearly fainting, dizziness, quick weight gain, which is about 3 pounds over 2 to 3 days, as well as swelling in the legs, can be indicative that your heart is not able to pump effectively, and can be indicative of heart failure. So as I said, not all chest pain is in the chest. Actually, only about 50% of people experience symptoms in the chest. It's also very common to have prodromal symptoms. Prodromal symptoms are the things that you can't quite put your finger on. You feel like something's wrong, but you don't quite know what it is. These symptoms can include weakness, shortness of breath, excessive fatigue, sleep disturbances, increased anxiety, potentially a fleeting chest discomfort. Maybe you feel something in your chest, but it goes away quickly. That could be an aching or even a sharp pain just for a moment. Excessive nausea, heartburn, or indigestion, something that maybe you take some medicine and it doesn't go away. If that's still there, that can be indicative of a heart problem. Women generally present with atypical symptoms. They generally do not present with pain in the chest. A lot of times women will have abdominal pain, nausea, shortness of breath, and weakness. And actually for women, a cardiac event may be the first indication of heart disease. Women typically have a higher rate of complications and higher mortality rate as well. This is why it's so important to know your risk factors and to seek treatment early. So when we talk about risk factors, there's a whole list up here. You guys can read them all. Tobacco use. We all know that tobacco is bad. Shouldn't be using it, but why? Why is tobacco bad for you in relation to the heart? The nicotine in tobacco actually causes a constriction of the blood vessels. So when you add that to the hardening of the vessels and the accumulation of plaque, when that tobacco constricts those vessels, you're actually setting yourself up for a heart attack because there is no room for the blood to flow through. When discussing obesity and physical activity, the heart is a muscle. Just like every muscle, if you don't exercise it, it gets weak. So when the heart gets weak, you're at higher risk for problems. Cholesterol and fats. I have up here high levels of LDL, which is your bad cholesterol, and low levels of HDL, which is your good cholesterol. So these are risk factors. You want to have good cholesterol in your diet, and you want to have not so much bad cholesterol in your diet. Bad cholesterol, or the LDL, actually increases the formation of plaque in the vessels, whereas the HDL actually helps to eliminate it or helps the body process those bad cholesterols out of your body. Stress. Stress is taxing to the heart in any sense, as well as high blood pressure, excessive alcohol consumption. Excessive alcohol consumption can lead to obesity, diabetes, elevated levels of bad fats, as well as high blood pressure and even heart failure. These items are listed as modifiable risk factors because these are things that you can change. These are items that you have the power to control and even eliminate. So these all contribute to the development of heart disease, but you have the option to treat them or control them. Non-modifiable risk factors, on the other hand, are things you can't change. Age. The risk for cardiovascular disease increases significantly for men over age 55 and for women after menopause. A family history of heart disease is also an additional risk factor. Anybody with a relative, especially a first-degree relative, like a mother, father, or sibling that has heart disease, you are at a higher risk for developing heart disease. And ethnicity. Anyone with an African or Asian background is at higher risk for heart disease as well. This is why it's important to know your family history. So when we discuss making changes and trying to prevent heart disease, it's very easy to say, these are the things you should do. It's not quite so easy to do them. So these are small steps to consider if you're going to try to improve your health in terms of your heart health. Walk 20 minutes each day. Walk briskly. If you can't do 20 minutes, do 2 10-minute walks. You're shooting for 20 minutes a day. Take 5 minutes to breathe deeply and think positively each day. There are actually studies that show that this decreases stress and improves heart health. Add 1 extra serving of fruit or vegetables every day. This to me seems like one of the easiest things to do. You're packing a lunch, eat what you're going to eat already, throw in an apple. Eliminate 1 sugary drink each day. So if you're used to having 3 cans of soda or 3 bottles of sweet tea, decrease it by 1. So just have 2 that day. It would be ideal to substitute water, but even a low-calorie option or a diet option is an improvement. And eat 1 serving of high-quality fish each week. No, this does not mean the 2-for-2 fast food fried fish sandwich. That does not count. So you are looking for a lake trout, a mackerel, a tuna, halibut, and American catfish, and salmon. Those are all good choices. Those all have high levels of the good fats, which will help eliminate the bad fats. So shoot for 1 serving. Ideally, it would be 2, but we're talking about small steps. So add 1 serving of good fish a week. And for those of you that are already doing the small steps, go a step farther. Healthy fats. So you're going to try to increase your healthy fats. These come from extra virgin olive oil, fish, and nuts. Oh, and avocados as well. Those are all good foods that will increase the healthy fat in your diet. You want to try to decrease the unhealthy fats, things like butter, lard, whole fat dairy, fried foods, and fatty meats. Those are all things you're going to try and eliminate from your diet. Increase your fiber intake. Fiber helps to lower your cholesterol and stabilize your blood sugar, and those individuals with a high fiber diet have a 40% lower risk of heart disease. Take medications as prescribed. This is all medication, not just heart medications, but especially medications that are prescribed for heart and blood pressure conditions. Stopping suddenly or taking more than or less than your indicated dosage actually increases your risk for heart attack, stroke, and heart failure. Learn your family history. As we talked about before, this might be your only indication, your only risk factor for disease, and if you don't know it, then you don't know that you're at risk. HR and blood work, these are great ways to know your numbers. If you know your numbers, you can know whether or not you're at risk, and coaching actually tells you what to do with those numbers or if any of your numbers are concerning. 15% of patients actually have no symptoms prior to a cardiac event. So the HRA and the blood work and the coaching, if you have no symptoms, this might be the only way that you know that you have a problem. Stress and illness, such as colds and the flu, are incredibly taxing on the heart. If you have heart disease and you don't know it, additional stress, such as the flu or a severe cold, might be what sets you over the edge and actually causes you to have a cardiac event. So as I stated, nobody expects to have a serious cardiac event, but it's already affecting you. You already have this buildup of plaque in your body that you don't know how bad it is. So really, you should take steps to live your healthier life, even the small steps as I described, and seek help if you're having any warning signs. It's important to pay attention to those symptoms, and that might be all it takes for you to know that something's going on. That was a lot of information. It wasn't all super interesting, but that's all right. If anybody has questions, I'd be happy to answer. That's really hard to narrow down cardiovascular disease into a very small topic. Each topic I could talk about for hours. You can talk about nutrition, you could talk about warning factors, you could talk about treatment and prevention. Each of them is actually their own topic, but if you have any questions, I'd be happy to answer.